The following is a special presentation of KNX News 97.1 FM.
From the Odyssey Soundspace on LA's Miracle Mile, this is Deadly High, Teens and Fentanyl, a KNX News Town Hall.
Here are Vicki Moore and Mike Simpson.
Alexander Neville, Melanie Ramos, Cade Kitchen. These are the names of just a few of the teens we've lost here in Southern California, and they are why we are here tonight.
Every generation in recent memory has had to deal with its own drug crisis, but now it's a pill, just one pill that can kill in a single dose, and that's what our kids today are facing. And that's what brings us together for this KNX Town Hall.
Fentanyl is a synthetic opioid. It's up to 50 times stronger than heroin, 100 times stronger than morphine. The CDC estimates over 150 people die in this country every day from overdoses of synthetic opioids like fentanyl. 2/3 of the 107,000 drug overdose deaths recorded in the U.S. last year, they were linked to these drugs. And just today, the LA County DA announced the formation of a working group to hopefully deal with this crisis.
Over the last few years, deaths from drug overdoses have reached record levels. We've also seen record numbers of teens dealing with acute mental health issues. Opioids are easier than ever for kids to get their hands on, whether it's from their parents' medicine cabinets or just dealers on social media platforms. And this is why we're here.
We will be joined for this commercial-free hour by people of all ages who have either been personally devastated by fentanyl or who are working to ease the crisis. Joining us here on stage throughout the show, LAUSD Superintendent Alberto Carvalho, a member of that new county fentanyl working group, and on the couch for the hour, Amy Neville. Her son, Alexander, died at just 14 years old in June of 2020 in Aliso Viejo after a fentanyl overdose.
So our first panel on stage with us here are two LA public school students who are both living through the fentanyl crisis and working to stop it. Ava Boris is a senior at Van Nuys High School's Medical Magnet and a member of the Superintendent's Youth Advisory Council. Nathaniel Shin, a senior at North Hollywood High and a student representative on the LAUSD Board of Education. But our first question goes to Amy Neville, whose 14-year-old son, Alexander, died from just one pill he got from a dealer on Snapchat. Amy now tells us her story in hopes of saving other families from the pain that her family has suffered. And where we're going to begin, Amy, is at the end. Because I think that we hear about kids taking pills. We hear about the fentanyl crisis, but we don't often talk about the families left behind. And you've talked about what Alex never intended for you to see that day. Tell us about that.
So that day, long story short, I walked into Alexander's room to find him what looked like he was sleeping on his floor, except for he was blue. And he was gone. He was lifeless. His dad immediately started CPR. I called 911. I latched on to his sister immediately to keep her from running up there to try to help. And, you know, from there it's a day of blur, of distinct memories, but yet surrounded by a lot of blur. And, you know, a lot of times when I'm falling asleep at night, those images kind of play in my head like a slideshow. You know, this year, Alexander's sister became older than him, and that was tough. That's probably been one of the hardest. There's a lot of firsts, right? You have your first Christmas, your first Thanksgiving, and all of those are hard, but the hardest has been his baby sister becoming older than him, and every time I think about that, it still makes me want to cry and breaks my heart because she's growing up without him. And there's a lot of times, you know, where I wake up in the morning and it's almost a reset, like, okay, wait, I have to remind myself of what's really happening in our life and then check in for the day and get started from there. You know, Alexander left us with the message of do uncomfortable work. And sometimes that's just getting out of bed.
You got that tattoo, right? It's the only tattoo you have.
Only tattoo.
Tell us about that, because you said do uncomfortable work.
It's Alex had written on his bedroom wall, do uncomfortable work on a lined notebook paper. And, you know, once I saw that after his passing, I knew that was my mantra for the rest of my life. And like I said, some days it's getting out of bed, and some days it's, you know, showing up in DC to fight legislation and bring about change in our country.
We see that with a lot of families who have experienced this. Is that kind of one of the ways to try and keep going to become
It's
an
interesting.
activist?
It's a way to keep going, and it's also a way to avoid the pain. I know that sounds crazy
you're working at
because
something, right?
yeah, like Alexander couldn't have died for a drug dealer to make a couple of dollars. His death has to mean something. We have to bring meaning to Alexander's death and all the other kids. And you know what? And if a parent isn't going to come out and rally and things, that's okay too. You know, we need people on the front lines, we need people behind the scenes, and we need those that just can give out hugs.
Is there a day that you don't replay what happened in your mind and say to yourself, if only I'd done this differently? Is there anything, you did everything you could, but do you think, I should have done this?
All the time. There's that constant like devil angel on your shoulders. Like if we had only done this, if only, then yeah, but you know, you did these things. You checked his social media. The internet went off at 9:00 at night. You were getting him help. You know, so it's I try not to go down that path because I spiral. You know, I don't want to go down because then it's going to distract me from the important work that I really want to do. You know, but Alexander is always on my mind, constantly thinking about him. And some days it's really loud music, and sometimes it's really soft, like background music.
I think about the bedroom and finding him, because that kind of brings it home as to what we're dealing with now, right? It used to be, okay, you go to a party or something, and then who knows what's going to happen. You go to school, you hope you're safe, but not always. You can't watch everybody all the time. But a kid's bedroom is supposed to be the safe place for them. But when we're dealing with this, it no longer is.
You know, and Alex is not an exception to that. Most families that I meet are parents who found their kids the following morning in their bedrooms or some point in the day in their bedrooms. What, like you said, is supposed to be the safest place.
Have you changed his bedroom since then?
So we actually moved from that house, which is hard because my sister, as my sister-in-law put it, she's like, it's a portal to another world, you know? But I've set up his bedroom exactly how it was. Everything's in there just like it was.
In your new home?
In our new home. So Alex still has space, but you know, I go in there in that space sometimes and just talk to him. That's where his urn is. That's where my mom's urn is. That's where all the animals' urns are. It's like become this little mausoleum of sorts, but you know, his bed is there. The beanbag chair he died on is there. You know, I just need to have that space for him because that's where I can go and just kind of meditate and think about things.
Yeah, you can be in there. Amy, you're going to stick with us for this hour, and we thank you for being here. I want to bring in our students, Ava and Nathaniel. And Ava, we'll start with you. When you hear this, does it sound familiar at all from what you've experienced, what you have heard, what you know that maybe some friends or other classmates have been going through? Because you start to see, at least other high schools or around the district or in Southern California, you hear these news stories and you think, well, that kid was my age.
Yeah, I think teenagers can recognize, wow, that's someone close to me, that's close to my age, that feels close to home, but they always feel never me. I won't make that choice, I'm not that student. But it's not that choice. People, I think our age, are going in thinking, I know where I'm getting this from, I know this person, but really they don't. You don't know where they got it from. And so it's hard to watch these people who are so close to your age. And like you mentioned, your daughter getting older than your son. I mean, I think you watch people around you and be like, I will be there in 2 years, or I was there 2 years ago. And you look back at the student you were. And I know personally, I'll hear these stories from other high schools. And I don't know. It's this odd feeling of, wow, this is a really targeted population because they're vulnerable and because they don't understand.
You know, some people watching this now might say, she's leadership. She doesn't know. But you say that this affects everyone.
Yeah.
Tell me about that.
I feel like we definitely marginalize the group in which drugs impact teens. It's the kids looking for the quick high, the party people. But really, we're putting so much more social pressures and academic pressures on kids that I know students who are seeking things like Adderall for performance to compete better in their high schools. It's not just this idea of you go to a party, you don't know what's going to happen. It's in people's homes. It's for pressures beyond just feeling isolated. That's something we put on people just because we don't want it for us. But I think so many teens are being exposed because of different reasons that aren't being addressed, really.
And Nathaniel, is it really easy to get that sense of how widespread this is?
Well, I think as students, we're all familiar with addiction, and we have friends who've fallen into this vicious cycle. But what really scares me about fentanyl is that it's so potent, so deadly, that it takes a mistake, an experiment, to kill someone. And I think that's what sets this crisis apart and why the response is so different. Because like you said, Ava, it isn't this marginalized group where we can say that this is the population that we're going to target with these intervention efforts. It has to be something widespread across the district where we educate from elementary school the importance of healthy choices and where we inform students as they get older of the dangers that are out there.
There have been Just Say No campaigns for years, right? And kids don't always listen to teachers or adults or town halls. So when you talk to kids your age and you say, this is really dangerous, do they blow you off?
No, I don't think they do. And that's because I know that as students, we're all familiar with peer pressure, whether it's the fear of missing out, of hanging out with friends, or something far darker like fentanyl. But that also goes the other way. And so we have this amazing tool of students that we can reach who can speak to their friends and spread this awareness, spread this message. And so that's why I'm proud that as part of the district's fentanyl response and substance abuse response strategy, we're implementing something called the Health Information Project. And that's where we're training 11th and 12th graders with the facts on this crisis so that they can present these to their friends, their peers. And I think that is the most effective way to spread this message. When you see on social media, when you hear it from your friends, that this is the danger that is out there, and this is what you can do to protect yourself.
All right, thanks, Nathaniel. Superintendent Alberto Carvalho, we're going to turn to you now. Thank you for being with us. Several students in your district have overdosed recently on fentanyl. One girl, of course, we know, 15-year-old at Bernstein High, died in the bathroom there. She purchased, or the drugs were purchased off campus. We want to make that clear. But talk a little bit about what you're doing to make sure that these drugs are not passed around or dealt on campus, and also this new joint effort with the DA and others that has been formed.
Number one, let me thank KNX for this town hall meeting. Critically important, timely, and possibly life-saving. And I want to thank also the remarkable leaders that we have here as students, and certainly your lived experience in a very tragic way that I think you're taking putting into action to save others' lives. Nate actually spoke of one of the strategies. Number one, what you mentioned earlier, these silver bullet type pronouncements, whether they are slogans or campaigns, just say no, or the war on drugs itself, they're failed experiments. They did not work. So we need a multi-pronged approach that actually makes sense and is research endorsed. And at LAUSD, this is what it sounds like and what it looks like and what it feels like in schools. Number one, let's start with what Nate said. We launched HIP. HIP is a peer support system where we train students who have the trust of other students, 11th, 12th graders, who can speak with freshmen and sophomores in their schools in a non-threatening way because there's trust established. They are trained to deliver important information, education that can actually save lives. It includes also circles of trust for students who may actually be experiencing that type of trauma, stress, may actually have had some degree of experience with drugs, and in a small group they can open up to students. Those trained students then can refer students to trained professionals, to psychiatric social workers, to psychologists, to school counselors. That's one step. Second step is we need to do a much better job in the school system, in our community, across the country, and speaking with parents. Often parents do not know about the dangers, the threats associated with fentanyl. Sometimes the student, the youngster, the adolescent knows more than the parent. So through our Parent Academy, we've launched a number of courses available in a multitude of languages to bring greater awareness and education to the parents on the detection of certain signals, but also empowering parents with the ability to speak with students in a non-threatening way, in a non-judgmental way. If you speak with students in a judgmental way, they will close up in a non-judgmental way and create a level of awareness they need as far as the dangers associated with fentanyl. That too is not enough. We need rapid response entities. So education, community-wide, prevention, but then the availability of life-saving Narcan in every school. And we did that right after the incident at Bernstein Senior High School. every high school, every middle school, and every elementary school has these doses. They are life-saving. Since we made them available, they've been used 7 different times on unconscious students who were brought back into the normal respiratory cycle, possibly having saved their lives. And then the last element is law enforcement. You do need to have a certain degree of enforcement or police action that actually investigates. You're right. Some of our students have access to drugs passed on to them by other students, but trust me, there is an adult criminal entity behind the curtain that's using kids to pass drugs on to kids.
We've got a lot of Narcan questions, so we're going to bring up your chief medical officer in just a minute here to ask some of that. But I'm glad you mentioned counselors for a second there, because I remember back when I was in school, now years ago, the counselor seemed to be someone that everyone knew to go check in with to make sure you took enough courses to get to college. There wasn't actually a lot of counseling going on, so are we equipped to actually counsel kids who are dealing with stuff?
The councils are equipped, but I have to be very honest, in this school system and across the country, not enough resources are put into the counseling services. The recommended ratio of students to a counselor is 250 students per counselor. The average here in Los Angeles and across the country is 1 counselor for every 500 students. So often they do quasi-bureaucratic work, they do schedule changes, they advise students on credits required for graduation, often, unfortunately, not dedicating enough time to the actual life-saving work of counseling students. And then there's the other issue. Colleges and universities across the country are not graduating enough counselors for us to be able to hire. We actually have the resources. Yeah. We're in a hunt for the talent.
You want them
the talent is just not there.
We're going to go into the audience now, and we'll do this throughout the hour. We have Joseph Chun with us, who's a district parent. Where does your child go to school?
I have 3.
3?
And
Few of them?
Go to different schools.
What's your question today?
As parents, is there anything that we can actively or passively do to partner with the district on this issue?
Yes. So I spoke some of the things that I think parents have both a responsibility but an opportunity to actually intervene. And that is be involved in your school, participate in your PTA activities, know who your counselors are, support the school by being demanding of the services that students should be getting. As was suggested earlier, counselors are there to counsel, not just there to change schedules. Secondly, become actively involved in using the educational resources we have made available through the school system, through the Parent Academy, specific to drug and substance abuse, alcoholism, specific to fentanyl, as well as other threats to students. Use those resources, propagate those resources throughout your community, and then bring other parents, the parents who usually don't show up to these activities, to the schoolhouse to benefit from these learning tools and life-saving strategies.
All right, let's bring up Dr. Smitra Malhotra, the LAUSD pediatrician, chief medical officer for the district. So we've talked a little bit about Narcan. Let's talk about where it is being stored on the campuses and who is actually trained to administer it.
That's a great question. As a district, we've worked very closely with the Department of Healthcare Services Naloxone Distribution Project. They have provided us with enough doses for every K through 12 school in our district. And so every school has doses. Our high schools and middle schools have more doses than our elementary schools. Larger schools are also given more doses. The Narcan is stored in the health office or the main office, but every school makes a decision to where they can store Narcan, where it's most easily accessed. That's the advice we give each school.
And who has been told how to actually administer it?
Yes. So our nursing team is very active in the training process. All of our healthcare teams are trained on administration of Narcan. We also have our principals who ask our staff to volunteer to get trained. We have a very easy online training module that everyone does, and then our nursing team does a hands-on training.
So teachers are being asked to volunteer to do it.
And you'd be surprised, our teachers are very interested in volunteering to get trained because everyone in our district is partnering to work against this.
The student at Bernstein High, the 15-year-old, she died in a bathroom after hours. So if the Narcan was stored in the main office or in a nursing office, how would that have helped her?
We are also going to provide Narcan to our after-school programs so that they can also have those. And we are asking every school to also make it available so it's available after school.
Can I ask a question?
Of course.
Do you have anything in place where parents can go ahead and request it to get it in their own home?
That is a great question. As a district, we cannot distribute it to parents, but parents can go get it at pharmacies, as you know, and we are working on providing distribution access centers.
Do you
with
need
our
a
public health.
do you need a prescription for it, and how much is it?
In California, you do not need a prescription to get Narcan.
I'm curious for our students, neither one of you can take this. What have you actually been told through the school about what to recognize or where to go get this or what to do? Is it just kind of like, here's the announcement, we have it somewhere, that's it?
I can take this one. Speaking honestly, I knew very little of this. Through speaking to some administrators, I found out that it was an accessible tool on campus. But as a student population, I feel we're a little under-taught on this, a little unknown that this is a really valuable resource.
What more would you like to be told?
Honestly,
Because
probably.
you've got them here.
Yeah, just that it's there. That if you need support, these are the people you access, these are the tools you have, and here's your steps immediately. I mean, I can only imagine a situation where students would panic. That immediate moment of, I love this person, this is my friend, I don't know what to do. And the fear of being in trouble, almost.
Right, because doctor, how quickly do you have to get this to somebody?
Minutes. We have minutes. Yeah.
So they need to know
They need to know
who to
yes,
get to.
Who to get to.
And this is the nasal form.
The nasal form.
Students can't administer it, though. If they have a friend, could they or no? A student?
Narcan is very easy to administer. Students can administer
Are
it.
they allowed to?
But in our district, we have trained personnel that administer the Narcan.
If a student had it in their backpack and had the opportunity to use it, would there be any repercussions for that, or would that be allowed?
If you're saving a life, there's no repercussions.
And just circling back, because I asked, because I'm not familiar with, if I wanted to buy it, you said without a prescription, do you know how much it is?
Without a prescription, it's around $100, $120. So it's not cheap, but most medical insurances do cover Narcan.
Is there something else we need to realize about it? And we can dig into this more, and we will over the course of the hour. But this is not okay, you take it, you're fine, go about your business. This is get to the hospital afterwards, because you could need more.
So Narcan does reverse the effects of an overdose, but only for about 30 to 90 minutes. So a person can go back into an overdose situation. So that's why it's important when you administer Narcan, you call 911 immediately.
Nate had a question. Can
I think just adding on to what you were saying, Dr. Malhotra, we see combinations of drugs now on the street. Something called Tranq, for example, is a mixture of opioids and animal tranquilizer. And so if you're administering Narcan to deal with a Tranq overdose, it only covers part of that combination of drugs. And that's why, again, Narcan is a tool that we have, but it's not the only one.
I want to ask one more question of both of you for a student perspective. You know, we talk about fentanyl, right? But again, the student at Bernstein High was looking for Percocet. You mentioned Adderall. You're talking about Tranq. Why are kids looking for all these drugs?
Different reasons. Again, we think, why do kids turn to drugs? You think of the honest telltale signs. People, are they lonely? Are there other things happening, family stresses? But we're also putting these academic pressures on kids. Our society and our world right now is kind of chaotic, and teenagers don't really know how to operate on a baseline. And so I think the lack of accessible resources to turn to for this help and this counseling is leading for these excess reasons. And it seems like a quick fix to a lot of people.
You know, to a certain extent, it's a perfect storm, right? Number one, they're very cheap right now. These types of drugs, they're not sophisticated. They are basically manufactured in China. They're assembled in Mexico. They're brought into this country for distribution. Just 5 years ago, maybe a pill would cost $20. The pill now costs cents, 15 cents, 20 cents, less than $1. So this perfect combination that's quite disastrous of the ease with which individuals can access these pills, how cheap it is, right? And with the added threat that sometimes you're not getting what you think you're getting. You think you're getting Percocet, and it's a Percocet laced with fentanyl, which appears to have been the case with the sad fatality that we experienced in our school system.
All right. We want to thank both of our students who have been with us the last half an hour or so, because we're gonna switch out our panel. But thank you to Ava Boris and Nathaniel Shin, both of these LAUSD seniors who joined us on this town hall. So thank you. And
Amazing leaders.
yeah, I want to ask you for a second, because we were talking before we got on the air, and you know, the terminology is one thing, but we can't even really say laced anymore, can we?
Yeah,
Because
we can't. These are counterfeit pills that have been made to look like legitimate pharmaceuticals. Again, they are fake and counterfeit, and that's exactly what we should call them. So people understand the deception behind it.
Superintendent, obviously one of the first districts to do this, and for a reason, to bring the Narcan into the schools, but you heard the students here asking for better knowledge about what to do, people to ask, should the teachers be told that you need to train how to administer? You shouldn't have to volunteer for this? I mean, what more can you do now that you've got it there?
Well, number one, I think we can always do more. So I was actually a bit surprised that the students asked for more information. We thought we had done a pretty decent job in terms of creating greater level of awareness, but I just heard from two remarkable leaders, one who is the student school board member.
These are the kids who pay attention.
Right. So that forces me to elevate a little flag of concern, right? Secondly, we do believe at this point we do have the number of individuals in schools who are trained at an appropriate ratio for the student body for us to be protected. Thirdly, look, this is one where a redundant approach is actually the best approach, meaning the more people who are trained, the better off we are. We're not limiting the number of people. We're saying anyone who wants to get trained can get trained. Obviously, we started with the individuals who had some degree of medical training and the administrative staff and anyone who has a walkie-talkie. Why? They're hearing what's happening in the school. They can rapidly deploy. But again, a redundant approach, a fail-safe approach, where everyone has minimal information that can actually save a life is the best approach.
I want to add one more quick question. There's a social media component to buying the drugs, right? Could there be a social media component for kids to get more information, reach out, something anonymous? Because I feel like assemblies that are called or announcements in the morning aren't really taken seriously. Is there another method, an online method, where kids could report someone?
Actually, very, very good question. On the information side, on the education side, we do have a strong presence online specific to the dangers associated with fentanyl, how it is pitched to kids, how it is sometimes disguised even as candy or some other types of drugs. With that said, we have a very effective tool in our school system that allows for anyone, student, parent, employee, to anonymously provide information to report someone who's dealing, who's passing on drugs, someone who's consuming drugs. And that's the LASAR. That's the Los Angeles System of Anonymous Reporting. It was acquired a while back to provide that safe, anonymous way of actually passing on information regarding these types of cases.
But to the kids' points, and just one, I'm an LAUSD parent. I'm a news anchor. I didn't know that existed.
And actually, we have a student who was going to ask a question about this, and apparently he didn't know it existed either, because and we'll bring him up, and Isaiah Foreman, if you want to come up here. What do you need? What do you want to see? Because it seems like you didn't know about this process either.
Can you repeat what you just said?
Well, I think you were going to ask about is there a way to report?
Yeah.
Yeah.
So
the superintendent is saying there is, but maybe that didn't make it all the way.
So
to you.
Is there a way to report it anonymously? Because if so, if that's the case, our students are afraid to to report because they're scared to get for their a retaliation from the students if they find out who reported it. So they want to know, is there a way to anonymously report it?
Yes, so there is. It's called a LASAR. It's an application. You can access it through any smartphone, whether it's an Apple phone or any other type of platform. Download the application. It's LASAR, LA System of Anonymous Reporting. Fairly new acquisition. What I'm hearing is we need to do a much better job in terms of create a greater level of awareness, both with parents, the workforce, and students alike. So you have the tool, but it seems that the tool is not being used enough, or there is insufficient information about the availability of it.
Well, and to his point too, I think we can all remember high school. You can be pretty nervous to rat on another kid or say something. So how do you get past that?
Again, there's an element of desensitization around this issue and making students feel comfortable about the use. That's why HIP, this approach that's led by student leaders after they are trained, and they become the influencers on this topic in schools. That's why we believe that peer-to-peer mentoring, peer-to-peer information can be much more effective because it takes away the threat that sometimes comes with a voice of authority bringing this information to the students.
And, just to real quick, I think our youth need to understand too, this isn't telling on your friend for stealing a candy bar from the 7-Eleven. This is life or death, and you do not want to bear the burden should your friend pass away or somebody that you care about passes away. After Alex passed away, I heard from multiple friends who were doing the same thing, how sorry they were, and their level of personal responsibility they felt in his death because they didn't say anything.
We want to bring in our other panelists here, and we're happy to have them. Dr. Scott Hadland is Chief of the Division of Adolescent and Young Adult Medicine at Massachusetts General for Children, also at Harvard Medical School, and he conducts research on the intersection of opioid addiction and teenage mental health, also routinely treats teenagers. And Detective Art Stone, LAPD, the Gang and Narcotics Division, and lead of the Special Fentanyl Investigations Unit. And then, of course, the superintendent will remain with us, and Amy Neville as well.
Detective, it's been said that ordering fentanyl online is as easy as ordering a pizza. But how do you stop it?
I think we've heard that here, and the way we stop it is get that voice out to the youth in the room and the exceptional leadership that we just saw here. How many people are under 18?
Lots of hands.
A lot of hands.
Most of the hands.
These are the people that are going to be sitting in my position, the doctors, in your position and whatnot. So why wait? If you're close to 18, the way you get that out to people is you be the leaders that you want to be. You've already represented that by being here. So go out and get that information out. And like we talked about, everybody has heard friends don't let friends drive drunk. Don't let your friend take pills. And if you do, find somebody that you can trust and tell them about it. And I guarantee you, with the conversations that are being had right now, that'll turn into hundreds of people doing it, and that'll be a better method to fight the problem than anything else. And it gets the word out to the resources that are available to them in the school as well.
Are we in a different kind of scenario, though? Because, I mean, some of us here remember going out to the soccer field, and they would have a crashed car, and one of the students would play the part of someone who died in a drunk driving crash, or they would show us a very graphic movie, and maybe it got to you and maybe it didn't. But now, you can take this at home, you can take it with your friends, you can take it apart. You don't have to drive drunk. You can go and get a pill on Snapchat, and you can, or your friend gives it to you. And I trust my friend who gave me this, right? So why wouldn't I take it? They seem to think it's safe.
Well, the simple answer to that is the message that needs to go out. If this pill didn't get given to you, and we said it how many times while we were waiting to go on here, if a pill didn't get given to you by a doctor in a bottle with your name on it from a pharmacy, it is a counterfeit pill. Whether it contains fentanyl as an opioid, whether it's representing itself as Adderall and contains meth, it is an illicit drug that now we're saying up to 6 out of 10 times has the potential to kill you. Get that message out. When you're talking about how do you stop Instagram, Snapchat, and all these forums, well, hold those forums accountable. We've already had that conversation. But as individuals, we don't have to use it. We don't have to look at it. We can talk to our friends and tell them, hey, don't spend your time looking at that. Everybody has somebody standing next to them that will see this happening and can intervene right then and there.
Detective, get into why these drug dealers, people think, well, the drug dealers obviously want to kill their clients because fentanyl is killing. Chocolate chip cookie. Talk to me about that.
So we're going to steal. She had chocolate cookie. I have cake batter. But when you take fentanyl is the big topic, but you have meth. It doesn't matter what the substance that you're putting it in. If you want to make something look like a legitimate pill, you put binders and all the things that hold it together and give it its volume, and then you put that substance, fentanyl, in there, and you mix it up and you color it and you stamp it and you make it look like something it's not. But you can't control the amount of fentanyl that goes in it. The chocolate chip cookie analogy is, imagine making chocolate chip cookies and swirling around the batter and then just plop some down here. Well, you'll get one cookie that's got 20 chips in it and one's got 5. How do you control that? And then if you're a distributor, a trafficker, a cartel level pusher that's setting this out, do you really care if it's going to contain 5 chunks or 25? So that's the problem, is if you're taking a pill, if you're buying something, as we've talked about the recent tragedies where you think you're buying a Percocet, you're not. You're buying a chocolate chip cookie that probably has 20 chunks of fentanyl in it.
That's where we get that one pill can kill phrase.
Absolutely the best
Because you don't know which
phrase.
one you're going to get out of that
Yeah.
batch that you might have bought, or even just the few. That you might have
Absolutely the
gotten
best phrase anybody can take away from this whole narrative.
Doctor, I want to come to you and touch on something that we talked about before, which is, it's not just someone seeking out a high for something. It's kids feeling like they need uppers or they need downers for all sorts of reasons. I mean, what do you see where this is so widespread?
I mean, there's a lot of different reasons that kids will use pills. And you're right, the context differs, and that means the interventions that we deliver need to differ as well. So some kids are using because they're experimenting in the context of a party or some other social or recreational environment. But a lot of the kids that I see are struggling with mental health problems. And that's not to say that mental health problems drive people to use substances all the time, but they sometimes do. And because we live in an era in which the drug supply is so dangerous, we need to make sure that if somebody is struggling with mental health problems, we're doing two things. One, we're making sure that we get them connected to effective treatment. But then two, we're also talking to them about some of the dangers of the drug supply right now so that they understand that a pill that might be billed to them as Xanax, something that can help address their anxiety, is actually more likely than not to be counterfeit and could contain fentanyl and kill them.
The mental health crisis, I mean, that is a big mountain to climb. I know college students who said that they tried to make an appointment 3 months out. You've talked about the ratio within LA Unified. We want to connect kids to counselors. We know that's a good approach, but it's expensive and they're not available. So then what?
Well, we've got a massive training gap. So, as an example, in my own field of pediatrics, it's only been in the last few years that we've developed this entire new workforce of pediatric addiction specialists. If you have a heart problem with your kid, you take them to a pediatric cardiologist. And this is sort of a new branch of pediatrics where we're really working to address mental health problems and addiction, because for so long it's been siloed off. Addiction treatment happens in different settings from your pediatrician's office. You go see your pediatrician if you have a problem with asthma, you go see your pediatrician if you have a problem with diabetes, but if you have a problem with addiction, you have to go to this other place. And so we have a workforce gap. We have difficulties linking across these gaps to specialists and getting people connected to treatment.
What about just the intake? I mean, recently it was recommended that I think it was kids, and young adults be screened for anxiety and depression. But what about being screened for drug use?
Well, that actually is happening in some settings.
Is it?
So here in my own state of Massachusetts, we actually instituted universal drug screening across our secondary schools. It was met with some mixed success. There's some worries that not every kid is going to feel comfortable disclosing this information, even when you try to make it confidential, even when you create a welcoming space for it. But I do think that schools are a key place for us to be able to identify kids who are starting to have problems. And then we need to, as pediatricians, do a better job of being available to families when they need us, because families like Amy's shouldn't have to struggle to find help. And yet that happens all the time.
And Amy, I want to bring you in and get your thoughts on that, because when we talk about how young to start these conversations or to start screening or what have you, I mean, your son was 14. This is not like, they're 17 years old, 16. This isn't a high school problem.
Yeah, we thought we were prepared for Alexander's experimental phase. Alex was that kid that came home from first grade drug prevention week and was like, ooh, tell me more. This sounds interesting to me. And so we educated ourselves year after year, had those conversations with him all of the time. As, they became more and more mature as he got older. And, we thought we were ready for that experimental phase, but we did not know about fentanyl, number one. And number two, we were waiting for the treatment place to get back to us with their recommendation on what to do next when he passed away. One thing that I haven't heard brought up when it comes to mental health is the social media aspect to all of this. And, until we as society can get a handle on what the impact social media is having on our kids, we're not going to get a handle on these things. We have got to get after these companies to do better for our kids, to make a safe space for our kids, especially those that allow them to be on as young as 12 years old. Snapchat came out in July with a report on what they're doing to combat the U.S. fentanyl crisis. And, they've got all these Band-Aid ideas and things that they're doing in there. But we're talking about a huge gaping wound here that needs needs major surgery. And at the end, toward the end of that, they state how, teens are turning drug use is on the rise because mental health issues are on the rise. No acknowledgement of social media's role in that rise, because if you look at these 3 different things that are on the rise, they are all rising together.
Very quickly, and to that point, social media, big component. You're going to go to Washington next week?
Next week I'll be in DC, hopefully talking to legislators on COSA, the Kids Online Safety Act. I know we don't have a lot of time, so I won't go into it, so go look it up.
We want to go back to our audience now. And Natalie Perez Morales, LAUSD student, what's your question?
Hello, my name is Natalia Perez, and I'm a student at Venice High School. And my question is, Black and Indigenous people are experiencing historic rises in drug overdose deaths. And why is that the case, and what is being done to support communities of color?
So, I think it's no mystery. Earlier on today at the press event, it was very clear that the victims associated with fentanyl are not equally distributed across the socioeconomic spectrum or the racial and ethnic distribution of the population across Los Angeles or across America. It is disproportionately having a deeper, more tragic impact on communities of color, poorer communities. If you're dealing with trauma, stress, if you're living in an abusive or fragile environment, you're at greater level of risk. So there's an interconnection specific to those elements. What are we doing about it? You probably have heard, or not. The BSAP program, Black Student Achievement, with additional resources, additional counselors, additional psychiatric social workers dedicated to schools that have a higher percentage of populations that are at greater risk. In addition to that, using one-time federal funds that will be available for the next 2 years. We are in the market trying to hire an additional 900 psychiatric social workers to distribute throughout the school system. The challenges we have addressed before is that we have the resources and the need, but the talent is not there. There's a huge gap. Let me speak a little bit about beyond what we're doing, what others should be doing. We know we need counselors. We know we need psychologists, psychiatric social workers. How about in tandem with college tuition forgiveness, creating upfront incentives if you choose to go into these areas and you dedicate 2 to 3 to 4 years, then you get reductions on your college debt or total elimination of your college debt if you choose to go into the public sector and become a psychiatric social worker, those areas where right now you don't have enough professionals going into these areas that are so desperately needed in our school systems.
Doctor, I want to bring you back in when it comes to these conversations that you have. And do we go about them the wrong way sometimes? I mean, what's the way to actually break through to a teenager? When you're going to treat them or when you're going to warn them about this?
Yeah, I worry that we have a lot of conversations that are really based in fear-mongering and scare tactics. And I have a lot of teens who come to my clinic and will tell me that they heard from somebody that cannabis will kill you, or if you vape, you'll have severe lung injury and you're going to die. And there are harms from other substances. Don't get me wrong, but we need them to believe us when we then tell them, no, really, fentanyl will kill you. A single pill can kill you. And so we need to have very careful, balanced, fact-driven conversations with teens about the actual harms. And we need to be realistic so that they believe us when it matters.
There seems to be that break, though, that hasn't gotten through to everybody yet, that the pill somehow seems safer because it's a pill. Somebody made this. And maybe it's that, what you were saying, officer, that it used to be that you would get it out of medicine cabinets, but that's not where they're coming from anymore.
Not only is that not where it's coming from, but to go back to a couple questions ago, not just one pill can kill you. Everybody's seen a Xanax. It's got those 4 little score lines on it. You take 1/4 of that, and that can kill you. You cut the little blue ones, the M30s. Everybody's seen those. You cut those in half. That can kill you. So it's any substance that you're taking. The other idea, too, is we mentioned, somebody said just say no. Mm-hmm. Some of us are old enough to remember that. But there are also things like DARE. There are clergy. There are a number of resources that don't have to be put out there by government that we have right there at our fingertips. And the leaders that we have in this room, the young leaders, are the people to start that. When you talk about just say no, that's antiquated. It's been around maybe too long, but it's like technology. why don't we just find another version of that that's a little bit more what people understand today and let those people have the conversation in the school? You know, an after-school program that includes a bunch of kids talking about this stuff in their language with maybe somebody who can get down to that level doesn't cost that much. It's just time.
I want to ask a question of the audience. Hopefully a lot of you are LAUSD students. How many are LAUSD students? How many knew about the LASAR app that he talked about, the superintendent talked about? Anybody? One hand.
One hand.
One hand. How many of you would download and use an app, either this one or another one, if you knew about it, to report or talk about something anonymously when you were concerned about other kids using drugs? Good majority. So you just need more information then, huh? Okay. More information?
Absolutely.
Get that to them?
I mean, that's why I said redundant systems are the systems that work. You know, the peer mentoring approach, the counselors, the application. It's clear that the students don't know sufficiently about this. Still fairly new introduction of this app, but there's a lot of work to be done.
I wanted also on the technology to you, how do you actually fight this? If someone can just get somebody's Snapchat handle or Instagram, and that's where you can go and buy this stuff, I mean, what do you do about that? Because stemming the flow, we can't do that either. There's already enough here to kill everybody. So how do you fight it on social media?
Well, you have to fight it backwards. You have to get the awareness out there. You have to cut that willingness to use it. You have to take what we call the unwitting user that's affected by this, that didn't know what they were taking out of it. And then you come from what I do for a living. You have to attack that international, that interstate trafficking. You have to attack that regional trafficking that's distributing within Los Angeles and identify those things. And you have to throw resources at that, not take them away.
Do you have enough resources, though?
Flat out, no.
Yeah, you're saying
That's
throw
as-
resources at it.
that's
You don't
as
have
simply
them.
as I can say it. But, and that's, I'm trying to make that as responsibly as I can too. When times are tough, when we come out of an economy that just came out of a pandemic, you have to make changes. You have to trim things, but you also have to responsibly manage and say, okay, can we get past that now? Now is the time to start looking for those resources to capitalize on all of the conversation, because in the 3 years that I've been exposed to this conversation is louder than it's ever been. Now's the time to capitalize with that.
Doctor, why do you think we have been so slow on the uptake?
Well, at least on the teen front, this is actually a relatively newly exploding issue. So it's really just been since 2019 that drug overdose stats involving fentanyl have just skyrocketed. It's been, actually, we've experienced a near more than doubling, actually, of overdose stats from 2019 to 2021. And 3/4 of these involve fentanyl. So this is a relatively new phenomenon when it comes to the teen side of this crisis. So I actually commend the superintendent for acting so quickly. A lot of other school districts across the country are acting much more slowly.
It seems like something, though, that is scary enough that it would grab attention by now. And it has the attention now, but when you say one pill can kill you, don't take any pills.
Well, it's stigma. Society is still wrapped up in the old drug war and the old way. But, you know, we're dealing with a time where you do not have to have a traditional substance use disorder to die from drugs. You know, people see fentanyl on the news or they see the billboards or whatever it is. Oh, my family doesn't have a drug problem. That doesn't apply to us, but it absolutely applies to everybody.
Is there any way to control what your kids are seeing on social media? Because
Mine?
right? I mean, how do you do that besides shut it down?
And it goes along the lines with how do we have that conversation. We were talking backstage here about the conversation when I was growing up was don't use marijuana. It's going to lead you to this. It's going to lead you to that. It's going to lead you to the other. But the conversation I had was don't do it or else. The time has changed for that. As a parent, and I did it with my own kids, as soon as I started seeing things that I'm at work and it's making me tear up listening to stories, I changed the narrative with my kids and I said, look, I'm not telling you. I'm flat out begging you not to do this. Whatever I can do to convince you, ask me, no judgment attached, whatever you want to talk to me about. And, you know, you're still going to get a percentage of response back from that. But if everybody's doing that, if the parents are coming at their kids from an angle of, hey, I'm just begging you for your life's sake and our family's sake, please don't do this. That's a little different than telling them not to.
I have to jump in on because this is, I wholeheartedly agree. Kids are so resourceful, so brilliant. If you put obstacles between content and themselves, trust me, they will find a way to access it. Mainly if you say you cannot look at it, or it's forbidden, or it's dangerous. They will find it. So yes, there ought to be specific policies to these mega entities that basically make billions off of social media platforms. They ought to have policies. They ought to be regulated far more than they are currently regulated, particularly by Congress, by law. But the more effective way of preventing these tragedies is actually empowering students with information, education, on early detection, awareness, and prevention.
Let's turn to Micah Alligood, joining us now. Student, 16?
16, yeah. Hi, my name is Micah. I'm a sophomore in high school. Last year in October, my parents made the decision to send me to an in-person treatment center for addiction, and it saved my life. I don't think people my age, you hear about fentanyl and overdoses and drug addiction, but I don't think people really understand the reality of addiction and the reality of this, the severity of this crisis. I'm really fortunate that I've, been able to be clean for now more than a year, and I have, I've witnessed friends since getting out of my rehab, overdose and die off fentanyl, and it's a reality. And so I think people really need to understand that at a more, how would you say, I think it needs to be more than just this student died of fentanyl. I think you guys as leaders need to try to really show people the severity of it. And so I think my question really is, how do you guys plan to do that in schools? I think it's, mental health is a really important thing, and I think that now more than ever, mental health is a very big issue, and I think that people are going to use, if they're struggling with their mental health. So,
Mike, I want to jump in too, because on the mental health topic, you and I were talking about how you struggle even now. Mm-hmm. You've been sober for a while, but there are things that make you want to go back, right, and order online again and do things. So it's a continuing process, right, mental health?
Yeah, I think, there's a saying that in the fellowships, like the NA fellowship, that sobriety is an act of choice. You have to wake up every day and choose to be sober. And I think as someone who really struggles with anxiety and whose anxiety has actually gotten worse coming out of treatment, that choice is a lot harder than I thought it was going to be. So, I think mental health is a very important thing, and that it really determines how people are going to cope,
So let's go around on that. How do you make sure that this is not an unwinnable fight?
I'll take Alex's philosophical words. We got to do uncomfortable work, and we got to go into spaces that make us sometimes feel uncomfortable, and we have to be redundant in the way we do it. So it's about having professionals available. It's about being better at messaging. It's about making, in a non-judgmental way, students feel comfortable about revealing what they know. It's about empowering parents with information. It's about leveraging all the resources in the community. And it's actually about asking more of people like me. So, there's a learning moment for me here. Yes, LASAR has not been around very long, but we need to do a far better job at creating awareness around it, right? It's clear to me. So it takes all of that.
It's exactly what I do. I travel the country educating anyone and everyone that will talk to me, and even if they won't talk to me, they're still going to learn something from me. But parents and students and the schools are my favorite place to be. That 12 to 17-year-old age group is my favorite group to talk to. Whether it be school presentations, club presentations, you name it, I'm there. I will be there in a heartbeat.
I want to come back to something that you had said earlier, Amy, about stigma, and I think we all need to battle stigma. When I have patients who have cancer, people will show up at their family's door with casserole dishes and offering every ounce of support that's available. When a child is struggling with addiction or with mental health problems, it seems like nobody's there, and it's impossible to find treatment in many places. And so I think a big source of this is stigma. Families feel uncomfortable seeking attention or seeking help because they worry about the stigma of seeking help. And we, as sort of, others in the community, aren't always available and willing to help when we know that somebody is struggling. And so we really need to fight that.
I think oftentimes we don't know how to help, right? I mean, I've found that in my own personal life. It's just I'm out of my depth when it comes to mental health issues and depression.
Well, sometimes you don't need to offer answers. You just need to be available and supportive.
I'm curious though, because there's so much talk these days about, you know what, you should be proud about going to therapy, and get a therapist, and it's going to change your life for a whole bunch of reasons. But they say the stigma is gone, but then why can't people still go to each other and say, you know what, I think I need some help? Is that just kind of a top line thing that we're not taking the next step and actually doing it?
Well, I think it's especially tough for teens. I think it can be especially tough for parents of teens to have to go out and seek out attention, seek medical attention. And I also just think there's not a lot of places to turn. And so, whereas for adults, it might be easier for us to go online and find a therapist and connect via telehealth, it's much, much more difficult. It's a completely different landscape. And
a lot of
teens.
parents I've talked to, I just thought my kid was in a phase. These phases are way more intense and way more deadly than they were when we were going through a phase.
Who breaks the ice first? What's the easiest way to do this? Teen to parent, parent to teen?
Well, I think it's got to be a bilateral conversation that takes place not just once, but over time. And it sounds like Amy really fought to have those conversations in her family, and that's exactly what you want to do. You want to create an open, safe dialogue between parent and teen that recurs over time. It isn't just a single moment. And for parents, they really need to spend more time listening than they do talking. They really need to create the space to understand what their teen is seeing, what their teen is doing, who they're spending time with. And that creates the space for parents to understand when there's a problem.
Did the pandemic amplify this? Did this just make it so much worse?
I mean, there has been a mental health problem in this country for a very long time when it comes to teens. And, I think social media has been a big part of that. But the COVID pandemic has absolutely amplified this crisis. And we've seen that problems with mental health across all different types in teens have gone up.
Yeah, and I'll touch on the stigma part too. There's another side of the stigma as we talk about tragedy and share it. The stigma that if your family has been affected by this to that degree of tragedy, I can't tell you how many cases we've had where the family didn't want to acknowledge what the cause of death was. And that's just it's another form of stigma, and if you've got to deal with that tragedy. The other side of it, the positive, is particularly after COVID, I think we're starting to see platform for that. I can think of 3 anonymous online and telephone dial psychological help commercials that are really upbeat, colorful, but they would entice a kid. If you're a parent sitting there watching that, maybe you find a way to talk to your kid and say, hey, if you ever need something like that, that's probably a good idea. Just drop it in their mind, tell them it's okay, and walk away. And if they need it, eventually they'll bring you into the fold.
Sometimes you can just drop it and leave it and let it sit and simmer for a while. Maybe it happens that way.
That's true, but we professionals need to be there, right? We know that Amy was seeking out help and was struggling to find it because it wasn't available to her. And so there's a lot that we need to do. This work is hard and difficult, and when I see a teen in my practice, I'll spend 90 minutes with them the first time that I meet them, 60 minutes with the teen, 30 minutes with the parents. That's not incentivized. What's incentivized for pediatricians is to see the runny noses, check the ears, see a patient every 10 minutes. But this work is complicated and takes time. And we don't have a lot of space or resources. And I think that's something you're hearing from all of us, is that we feel resource constrained and yet need to do so much more as this kills so many teens.
2 quick points. Number 1, to your earlier question. Surgeon General of the United States of America, Dr. Vivek Murthy, recently said that the physical threat of COVID has been replaced by a magnitude of 10 with the mental health concerns specific to students, particularly as a result of the social isolation they went through, number 1. Secondly, a topic we have not discussed, we talked about the social responsibility of media platform owners that make billions on advertising and not regulating content or monitoring content, right? Creating platforms where drugs can be easily peddled. But let's be clear here. We have a drug problem specific to fentanyl in America today. Because at one point, pharmaceutical companies made billions of dollars selling pain pills with very little regulation. So that was an addiction that was created and poorly regulated. And there ought to be maybe some degree of social responsibility there that should result in investments into public systems like the school system here in Los Angeles, LUSD, and many other systems across the country.
Amy, I want to give you the final thought here. When you speak to kids and teens especially, what do you leave them with and leave us with that tonight?
To ask for help. You absolutely have to ask for help. I've heard from more than one teen is like, you don't understand, we just can't quit on our own. No, you can't. You absolutely cannot quit on your own, and don't even try. You need to go to that trusted adult in your life and tell them what's going on. Be completely honest with them. And parents, when your teen comes to you and is completely honest with you, it's your job to get them help and not freak out.
Thank you so much, everyone, for being with us. There is so much more to talk about this, obviously, but I think we've done well today. We're at the end of the hour. I want to thank all of our guests for taking time to share their stories and their expertise.
And special thanks to LAUSD for their partnership in putting this town hall together. If you missed any of the discussion, you can watch on demand, knxnews.com. For Vicki Moore, I'm Mike Simpson. Good night.
This has been a special presentation of KNX News, 97.1 FM.
Deadly High, Teens and Fentanyl is available on demand at knxnews.com and on the free Odyssey app.